Well, in light of the bed crunch at public hospitals, the Health Ministry is working to ensure that patients are cared for safely and comfortably. Senior Minister of State for Health, Dr. Amy Khor, says that our ageing population and smaller family units have led to increased demand for healthcare services.
For the past week, the bed occupancy rate at public hospitals has ranged between 75% and 95%, and waiting time for a bed ranged between 2 to 9 hours. While there are plans to ramp up bed capacity, this will take time.
Of course, we are also proactively taking measures to address the bed crunch. So, for instance, we have actively been looking at the available bed capacity in other public hospitals to ease the bed crunch in some of the hospitals like CGH, KTPH and Tan Tock Seng Hospital too.
Associate Professor Pauline Tay-Strawn says her husband was affected by the current bed crunch at hospitals. On Tuesday morning, she had dropped him at the emergency department at the National University Hospital to be treated for a chronic ailment. She says he waited 12 hours to get a bed.
I was stunned and shocked because I knew that we had a bed crunch. Because this was already highlighted, by news reports, several years ago. But I didn't realize that it was a sustained phenomena.
NUH clarified that her husband was warded close to 8 hours after doctors made the decision to admit him. NUH added that measures have been taken to free up or add beds, such as reviewing processes to enhance the right sitting of treatment. At the same time, Changi General Hospital also says it has put in place measures to ensure patient care is not compromised. Some community hospitals have also started to make use of their isolation rooms to take in more patients from the general hospitals. The Health Ministry says several hospitals like Khoo Teck Puat have started transitional care to help patients transit home smoothly, which then facilitates timely discharge. The Transitional Care Service at Khoo Teck Puat Hospital has served some 750 patients since it started in 2012. Currently, it's serving about 75 active patients. Now, usually the hospital makes about 3 referrals of this service a day, but over the Christmas and New Year's period, the hospital says that this has been bumped up to 10 referrals a day as doctors are discharging more stable patients to free up bed space.